to repair mutated genes of one's DNA that can cause unwanted health problems or diseases such as diabetes. They start off by introducing a new genetic information into the damaged cells. Then they locate the mutated cell within the DNA, and they inject that cell with a transportation vessel that is called a vector. That vector then comes with more risk and complications. Some of those risks and complications can be that it will damage the healthy cells that they have. It will destroy the cells that they already have, and also it can cause many new illnesses to occur. What are some of the impacts of diabetes on patients, you ask? Well, they come with positive and negative, as do a lot of other things. Some of the negative things are that the patient feels lonely. They feel as if they're alone because they're managing their care. They feel fear and anxiety of the possibilities of what can come or what can happen. They feel broken because they don't feel like they're complete. They aren't for sure why their body is functioning or not doing as it should. And they feel the overwhelming feeling of never-ending demands of the day-to-day, having to exercise, remembering to eat healthy, what they can and cannot eat, and how to stay away from foods with sugar. Some of the positive feelings are once they get a control to this disease, they feel like they have self-worth and self-control. They've managed things on their own. Feelings of success, better quality of life because they were so sick before and they never knew really what was going on. Healthier living, and they're more conscious and aware of what's going on in their lives. Diabetes does not just affect the patient itself, it affects families. Diabetes, some people manage their diabetes on their own, but many family members are also live with diabetes because they witness their loved ones with this disease every day. Diabetes is a family disease. So if you live with someone that has diabetes, you are as well involved in their care. They carry on the emotional burden of anxiety, the stress of remembering to do glucose monitoring, or if their family members have checked their sugars. If they're going to be out in public and something happens, the lack of education causes fear for everyone. Sometimes a lot of patients go to the doctor's office alone, and they don't go with their family members, so they are not aware of what to do when something's going on. They involve families feel more togetherness and more at home when they're involved, and when they know what's going on with the patients. And they have better success when others are involved. Diabetes is better controlled when families are involved with those patients. So, you ask, how is the accessibility of treatment for diabetes? The access for diabetes is everywhere. Now, with the new modern time and age, we have truckloads of information on the internet. There are so many sites. There are countless amounts of medications on the markets and samples in doctor's office that can be used to help control diabetes. There are all sorts of information online and pamphlets that you can find. There are diabetic clinics that you can go to and visit. There are endocrine that specialize in diabetes alone. There are group centers and meetings for patients and families, and normally if they're hospitalized, they can ask the nurses or the educators that are on the unit, and they can get referrals to go to different free sessions that will help them with teaching and managing diabetes. Is diabetes costly? Most definitely. It is very costly. The American Diabetic Association estimated that the total cost of diagnosed diabetes in 2013 had risen to a whopping $245 billion. Broken down, $176 billion was in direct medical costs alone, and $69 billion in reduced productivity. 43% of that was for hospital inpatient care, when diabetics have complications and they're admitted into the hospital and they have to get them on track before they go home. 18% was for prescription medications to treat complications, whether that's including insulin or pills, anti-diabetic agents and diabetic supplies like glucometers, the strips that are given for those, all those things have to be purchased. Physician office visits, and nursing residential facility stays.
Insurance coverage. Diabetes is primarily a self-managed disease. Adequate and affordable health insurance is important for people with diabetes to help them access the supplies, medications, for them to become educated on their disease, health care to manage their diabetes, and of course prevent or treat the complications. Insurance covers type 1 diabetes, type 2 diabetes, gestational diabetes, and pre-diabetic care. Some of the most important insurance carriers that we see in most of the hospital settings include, but not limited to, Medicare, Medicaid, and private insurances.
Diabetes effects on normal life. Does it affect your life? Most definitely. It's a huge shocker as a new diagnosis, and it's a big adjustment to anyone. It's a drastic change to your diet and eating habits. The normal things that you're used to eating every day, cupcakes, candy, chocolate, those things are the things that we love, but we have to learn to give them up. You have to start a daily activity and exercise regimen, which most of us don't do on a regular, but it's muchly needed with patients that have diabetes. They must have a plan or a schedule to follow, because they have to remember to take all their medications. They have to remember to check their blood sugars before every meal and before bedtime. They have to be sure to eat when they check their blood sugars or if they're taking insulin. And it's very hard for children more than anyone. Children have to know when to take their medications. They have to know and understand what's going on with their bodies, because when they're away from home with their parents, they're at school, they're with other children, they have to know signs and symptoms if something's wrong. If they're hypoglycemic or hyperglycemic and their blood sugars are about to drop, they have to know what to do. They have to know to go get nurses or an access to be able to get insulin administration. So it's a big adjustment. And for kids, it affects their siblings and everyone's in the house, because it has to be around. They have to know what's going on. Some of the other effects on life are, it can affect the quality of life if your diabetes is not managed correctly. If diabetes is managed correctly, you can live practically a normal life. It can affect marriages if they're not open about what's going on and what they're doing to keep up with their diabetes. And it can affect their sex lives, because diabetes can cause some erectile dysfunction, but there are medications on the market for that also. It can be passed to children since it is a genetic trait. And in parents that are diabetics can also, their children are likely possibilities that they can be a diabetic as well. It can affect your careers or work choices. Like, you cannot drive 18-wheelers, you cannot fly a plane, or you cannot drive buses if you are diabetic, because the risk of going into hypoglycemic or passing out, and you have other people's lives in your hands. So, but other jobs, it shouldn't affect as much. Harder for children, since they have increased activities, and like swimming, they have to remember to eat before, remember to eat after, so it's a little bit harder for them. And it does cause common mood changes, and is an increased risk for depression. Do we have support for diabetics? Yes, and extremely lot. There are numerous online groups. If you log in and type in diabetes, you will have countless amounts of sites that you can go to. A few of the common sites that we found for resources are Cornerstones for Care, and you can also get a diabetic health coach that will help you do meal planning, exercise planning with your day-to-day living. www.defeatdiabetes.org gives a list of diabetes education programs and peer support groups. And it lists every state in 50 states, and it shows in your location area where they are. Diabetes.org, if you go to In My Community, it shows you how to find your local office near you. And Diabetes Support Group has one on Facebook. And Type1Nation.org is one also.
Last but not least, nursing diagnosis. Our favorite. Risk for infection and balanced nutrition less than vital requirement, ineffective tissue perfusion, deficit knowledge, risk for unstable blood glucose. risk for disturbed sensory perception, deficit fluid volume, fatigue, risk for impaired skin integrity, and also disturbed body image. Medical management, medical and nursing management, risk for infection. Risk for infection, provide meticulous skin care, gentle massage bony areas, keep the skin dry at all times. Keep leaning dirty and wrinkle free. This will help with peripheral circulation, may be ineffective or impaired. The patient at risk for skin breakdown and infection. Administer antibiotics as appropriate for early treatment may help prevent sepsis. Continue on. Imbalanced nutrition less than body requirement. Identify food preference, including active and cultural needs. If the patient food preference can be incorporated into the meal plan. Such things as granolas, apples, and oatmeal bars are very healthy. Incorporate with dietary and requirements may be facilitated after discharge. You want to administer glucose solution as dextrose or half normal saline. Glucose solution may be added after insulin. Fluid may be brought. The blood glucose to keep the glucose to the normal 70 to 120. As carbohydrate metabolism approaches normal, care must be taken to avoid hypoglycemia. Ineffective tissue perfusion. Discourage smoking. This will help prevent vasoconstriction. Administrate oxygen therapy. It will increase the dilation of blood vessel and tissue. Perfusion can be improved. While the regular blood glucose checks can be tracked, progress the state of the patient. Deficit knowledge. You want to teach patients to treat hypoglycemia with a cracker, a snack, or glycogen injection. Hypoglycemia should be treated with a carbohydrate snack. If the patient is unconscious, give a glycogen IM by caregiver. Explain the importance of inserting the needle perpendicular to the skin, like a 90-degree angle. This ensures deep tissue administration of insulin. Risk for unstable blood glucose. Teach patient how to perform home glucose monitoring. Blood glucose monitoring with the loaner, lancet stick, with the lance. This blood glucose monitor before meals and at bedtime. Glucose values are used to adjust insulin dose. Instruct the patient to avoid heating pads. Always wear shoes when walking. Patients have decreased sensations in the extremities due to peripheral neuropathy. All this stuff we're giving y'all is very, very important. We have reference are located at Diagnosis of Diabetes and Pre-Lab, the National Institution of Diabetes, Digestive, and the Kidney Disease, where we retrieve some of our information. Also, the history of diabetics. And also, we treat information from different places with our nursing care plans to help incorporate this PowerPoint presentation to deliver the great information we need